Blood is essential to life. It is vitally the most important fluid for the body. It is paramount for maintaining the health and the life of the human body. So how does automation help in demand-driven, patient-focused blood supply chain? Let's take a look. Blood is our lifeline, and such an important lifeline deserves to be available to us whenever we need it. Let's take a look at what NHS in the UK is doing by managing this demand while still being patient-focused.
There is nothing more critical to life than blood, and for the NHS, one of the largest healthcare providers in the world, there's a complex and demanding supply chain for blood components of all kinds. This centre in Bristol is responsible for testing and processing donations, as well as managing and replenishing stocks at hundreds of hospitals across England. It's a round-the-clock operation that requires responsive, demand-driven planning.
Let's see how this unique supply chain is being augmented through automation and AI.
And by working with Tools Group, the NHS Blood and Transplant Service has been able to develop its Vendor Managed Inventory, or VMI service offering, to bring a new level of automation and intelligence to this unique supply chain.
As a result of this, they are able to plan all aspects of the entire demand-driven supply chain.
The partnership with Tools Group enables us to adopt a pull approach. So using VMI, we can understand real-time demand from hospitals. And understanding that demand enabled us to plan all the way back through the supply chain, through what stock we need to hold in hospital services, what the delivery profiles need to look like, what we need to manufacture, what we need to collect, and also what the mix of our donor base needs to look like.
The impact has been tremendous. Prediction without needing hospitals to demand is just one of the impacts.
And this tool, known as SO99, not only allows for intelligent prediction, supply and delivery without hospitals needing to order, but a greater understanding of the different blood components and types required at any given time.
In the case of NHS Blood and Transplant, we get visibility of what is happening at the hospitals almost every 10-15 minutes, so we can see what's actually in the blood fridges. That information gets sent back via an electronic signal, and then we're able to respond to that either by delivering an emergency order or just topping up to their required levels.
We can take responsibility for their stock, for replenishing it and making sure they've got the right blood at the right time in the right place. And the feedback we've had from our hospitals has been very positive. The ones where we've now rolled out VMI are telling us that, it delivers them a more patient-focused service. It frees up their time to do their core activities and their core role. It reduces costs as well. So it really is a win-win.
Hospitals have been able to save something like 20% of their delivery costs and at least 30% of component wastage, because we've been able to optimise the stock levels at the hospitals, and that ultimately results in savings for the NHS as a whole, and that money then can be ploughed back into patient care.
As we have seen, having a supply chain supported by automation and intelligence immensely helps in speeding up the fulfillment of any demands, which in turn ensures that the right items reach the right people at the right time in the right condition. Without technological advancement in supply chain, so much of our everyday lives would be drastically different. As technology develops, it strives to fulfill the changing needs of the society. Hope you like this video and thank you for watching. Don't forget to tune in to our other video case study series. Thank you for your completion. Stay informed with WITP's tailor-made online courses at igotkarmyogi.gov.in. Enroll to lead with knowledge, explore practical courses on emerging technologies. Deep dive into real-world applications through the WITP Digital Library and WITP YouTube channel. Your learning journey continues towards a tech-savvy, future-ready government service. Jai Hind.